Hello scholars, my name is Dr. Karis Dillon and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the like button and don't forget to subscribe. This helps me to make the videos that you want each and every day. Now in the last video, we covered anorexia nervosa, and in this video, we're going to cover bulimia nervosa. In order to be diagnosed with bulimia nervosa, an individual has to have the following symptoms according to the DSM-V. A person has to have multiple times in which they are binge eating. Binge eating is defined as 1. Eating a much larger meal than what most individuals would eat during a certain period of time. 2. Not being able to control what you eat during that time period. Most individuals that binge eat feel they cannot control how much they are eating. B. The person will attempt to not gain the weight of eating the large amount of food by forcing oneself to throw up, using diuretics, or misusing laxatives. The individual may fast or try to exercise it off as well. C. The binge eating as well as the strategies to not gain the weight take place at least one time a week for 3 months. D. The person will evaluate themselves, including their body shape and weight. E. This disorder does not take place during an episode of anorexia nervosa. Now, the clinician will want to specify if the disorder is in partial remission, which means at one time the person had the signs and symptoms of bulimia nervosa, but now they are showing only some signs and symptoms. If the client is in full remission, they'll also want to note this, which means that the person once had the signs and symptoms of bulimia nervosa, but now have none of the signs and symptoms for a significant period of time. The third thing the clinician will want to specify is the severity of the disorder and what the individual is using to keep the weight off. These techniques the person is using are called compensatory behaviors. Knowing how severe these are is important. Mild severity means this is when an individual will average 1 to 3 inappropriate compensatory behaviors a week. Moderate is when an individual will average 4 to 7 inappropriate compensatory behaviors a week. Severe is when an individual will average 8 to 13 inappropriate compensatory behaviors a week. And extreme is when an individual will average 14 or more inappropriate compensatory behaviors a week. How does a clinician know the difference between binge eating versus not? Many people will binge eat at holiday meals. If the amount the person eats when binging is comparable to a holiday meal, then it is considered binging. This amount of food would need to be eaten in 2 hours or less. If a person snacks all day long, this is not considered binge eating. This eating of excessive food has to come with the following psychological issues, and that the person must feel like they have lost control. This means once they begin, they will have tremendous problems stopping. Some individuals will even describe how they may disassociate from their bodies before or after eating. Binge eating can be planned or unplanned. Usually when binge eating takes place, the individual will eat food that they might normally try to avoid. Most individuals will try to hide their binge eating as well. Generally, they will eat until they become uncomfortably full. When a person decides to use a compensatory behavior, it is usually purging. Making oneself vomit tends to be the most common compensatory behavior, and it usually helps people feel as if they've gotten rid of the calories, which isn't always the case. The more that a person induces vomiting, the better they get at it, and they're able to do it quickly within the future. Sometimes individuals will use enemas, but they don't tend to do this alone. They will tend to have other compensatory behaviors along with this behavior. Individuals with bulimia nervosa will self-evaluate their body and weight on a regular basis. This tends to lead to their current self-esteem. Many individuals with bulimia nervosa have the same fears as those with anorexia nervosa. They fear gaining weight, and they usually have a desire to lose weight. They're usually dissatisfied with their body. Those individuals with bulimia nervosa tend to be in their weight range or can sometimes be considered overweight. It is also common for women with bulimia nervosa to have irregular periods or times where they don't have a period. They can also suffer from electrolyte imbalances that can be dangerous. Very rarely, they can suffer from esophageal tears, cardiac arrhythmias, and gastric rupture. Those that use laxatives can become dependent upon them. Gastrointestinal symptoms can occur as well. Each year, 1 to 1.5% of young girls can be diagnosed with bulimia nervosa. The disorder tends to surface in older adolescents and into young adulthood. It is found much more in females than in males. To observe someone with bulimia nervosa before the age of puberty and after 40 years old is rare. Most individuals will start compensatory behaviors after they attempt a diet and have a binge episode. For reasons that are not quite understood, symptoms of the disorder tend to wane over time, whether or not the person has treatment. Those individuals that have remission for over a year are much more apt to have positive long-term outcomes. 2% of individuals with bulimia nervosa will die within a 10-year period of time. This disorder is seen more often in post-industrial and industrial societies such as Canada, the US, many European countries, Australia, Japan, South Africa, and New Zealand. The individuals that have this disorder are generally white. There are lots of medical problems that come along with bulimia nervosa. One of these is extremely low potassium, known as hypokalemia. This is what can bring about cardiac arrhythmias. The disorder can also cause hypochloremia, which is an extremely low level of chloride within the body, and hyponatremia, which is a low salt level within the body. Inside the mouth, there can be a loss of enamel on teeth, and over time they can appear chipped. The salivary glands can become enlarged, and there can be calluses or scars on the top of the hand due to continued contact with the teeth. It is normal for an individual with bulimia nervosa to experience at least one other mental disorder. The most common are depressive disorders or bipolar disorder. Anxiety disorder, substance use disorder, and personality disorders are also common, especially borderline personality disorder. Hi, well, we have reached the end of our video. I can't thank you enough for the continued support as well as the wonderful comments that you have left on the end of videos. It's definitely a chance for me to be able to get to know you a little bit better. And if you have questions, it's a great place to post those questions so that you and I can get to know each other a little bit better and see what's affecting you in the world. I can't thank you enough. It's because of you that this channel is here, and I thank you very, very much. Have a great day.